I want to have a little chat today about some of the services Village Vet offers, and in particular today I'm going to talk to you about our emergency service. Okay, Village Vet has 2 emergency hospitals. Now it's quite important that I explain about these hospitals because they are quite unique. They have both been accredited as Tier 3 emergency hospitals by the Royal College of Veterinary Surgeons. Now, it's probably less than 1% of practices in the country have this accreditation. But what does it mean to you, the client, and your pet? It means that these practices have been accredited because they've got superb facilities, equipment, staff, protocols, even an emergency generator should the lights go out. What does that mean for your pet? It means that there's a vet awake and a nurse awake 24 hours a day, not the same one, obviously, in shifts. And these are vets and nurses who love emergency medicine and are studying further, attending courses, so that they are improving their ability in emergency medicine. So that should you call at 3 o'clock in the morning, your pet will see a vet who will diagnose, is more likely to diagnose the problem, have the facilities, the ultrasound machine, a lab, a laboratory up and going that can do full laboratory tests, including blood gas analysis, which in emergencies can be important, digital radiology, x-rays, digital x-rays. It means that your pet, the vet can diagnose your pet's problem quicker, and if surgery is required, respond immediately. Let me give you an example about the difference between the old and the new. I mean, even Village Vet 20 years ago, when I was practicing 20 years ago, if there was an emergency, a client would call me. I'd wake up at 2 in the morning, have to get dressed, tell the client to meet me at the surgery in 20 minutes, giving me time to get dressed and drive down to the surgery at night. Wake up along the way, see the pet. Now I discover at 2 o'clock in the morning, I need to operate. I now have to call my nurse, wake the nurse up, she has to get dressed, or he, and come down to the surgery and get everything prepared, and maybe an hour and a half later we're now ready to operate. This is an emergency, don't forget. We did this and we did quite well, but sometimes we didn't because it was not quick enough. What would happen if we needed a blood transfusion at 2 o'clock in the morning? We couldn't do it. Vet24 centers, you may have to drive an extra 10 or even 20 minutes to get there. But once you're there, everything happens easily, quickly, and far more efficiently.